This segment is brought to you by the Southeastern Spine Institute.
Welcome to Southeastern Studios, where we learn about the latest medical technologies and sit down with physicians who are prominent in their field. All right, today I'm sitting down to talk with Dr. Tim Bryan from Southeastern Spine Institute. Now, why don't you tell me a little bit about who you are and where you came from?
So born and raised here in Charleston, South Carolina. I went to undergrad at College of Charleston, medical school at the University of South Carolina, and then I did my orthopedic training in Buffalo, New York, followed by a fellowship in St. Louis at Washington University in St. Louis.
Now, did you ever have a moment where you kind of knew that this was the right career for me?
I did. So in medical school, it was just the exposure to the spine, training just in school, kind of the anatomy, the conditions, and the procedures themselves were fascinating to me as a medical student.
Now, what do you do here at Southeastern Spine?
So treat all spinal conditions from cervical to lumbar, from pediatrics to adults.
So you're working with all types of patients?
Yes.
But what is a typical ailment that somebody comes in with?
So the common things are sciatica or lumbar radiculopathy, a pinched nerve in the back causing pain down the leg. That's a pretty common condition. Other conditions, cervical radiculopathy, kind of the same thing in the upper extremity, so shooting pain down the arm into the hands, numbness and tingling. Those are the more common ailments.
Okay. Now, I don't know what any of that means, but how would one treat it?
So it depends. Most of the time, it depends on the severity of these symptoms. So some patients have sciatica down the leg, not so bad. It's manageable. It's only been on a short period of time. Sometimes we can treat those patients non-operatively, so without surgery, doing a combination of physical therapy, medications. Sometimes it comes to doing an injection that can be helpful. Sometimes those things don't work or the patients fail those treatments and they end up having surgery.
Okay, and walk me through the process of a new patient coming in.
So new patients, that's one thing that we pride ourselves on here at Southeastern Spine, the fact that everything's in one building and we can get the patients through quickly to get an answer and sort out their problems. So a new patient can call in, be seen, they get an evaluation with the surgeon, get imaging with x-rays. If they need an MRI, we can usually accommodate the MRI quickly, even same day in some situations. Then review that MRI with them and get a plan together, all in one day, typically.
And what do you think sets Southeastern Spine apart from other places?
I think it's having everything in-house so we can get them through quickly to get an answer. They're not having to go over here to get an x-ray, go over here to schedule an MRI with another facility that may take weeks. And the fact that we have a multidisciplinary approach with physicians in conservative care, so non-operative physicians and surgeons working together to take care of our patients.
And what are some of the new technologies that you've been working with recently?
So new technology, everything's moving more minimally invasive for most procedures. So smaller incisions with less blood loss, less soft tissue damage with splitting muscle as opposed to cutting muscle. It translates into shorter, less anesthesia, shorter hospitalizations after surgery, and oftentimes same-day discharge. So those are the kind of the way things are going, and including with that, minimally invasive is going on to robotics has been quite a big advancement lately.
And what would you say is your favorite part of getting to do your job?
Taking patients that come in that have terrible pain, inability to stand and walk, getting them mobile again, getting them back to their lives.
I gotcha. Well, thank you so much, Dr. Bryan. And if you guys want more information, you can go to southeasternspine.com. Be sure to join us next time with another segment from Southeastern Studios. And for more information, you can always go to southeasternspine.com.